let's return to one of our main stories, where the threat of more strikes by nurses has ended after a ballot on further industrial action failed to meet the legal threshold. The Health Minister, Caulfield, has given this reaction.
Well, obviously we welcome the news that the majority of nurses haven't reached the threshold to go and continue on strike action. We found when we took the pay deal, which Pat Cullen herself recognised was a fair deal and recommended it to her members, that the other nursing and healthcare unions such as the GMB, the Royal College of Midwives, recommended and accepted that pay deal for their members. And it is a fair deal. It's 5% for this year. It's an extra 2% on last year, which was already about 1,400 for an average nurse. So we welcome the fact that that we did reach an agreement. That pay rise is going to be landing now in over 1 million NHS workers' pay packets this month, and that will make a real difference to them. So we welcome the news today that strike action is on hold for nurses.
This could be branded as a relief for the government, but at the end of the day we still have that massive 5-day work walkout of junior doctors. So it's not really a relief, is it? You've still got a lot on your plate, and you've still got a lot of NHS workers who feel you're doing the wrong thing.
Well, absolutely. There's a lot of challenges, and at a time when we're trying to get waiting lists down from patients, we've made good progress. We've virtually eliminated the 2-year wait and the 18-month wait, but every day there's strike action that puts additional pressure on getting those waiting lists down. But it is, the Staff Council, which is made up of a wide variety of unions, from the GMB to the Royal College of Midwives, accepted the pay deal. That is going to be implemented this month, and I think nurses will welcome that, particularly at a time when interest rates are high and inflation is high. Having that extra money in your pay packet at the end of the month will make a difference to those working on the front line.
Was it right to reallocate pandemic planning resources toward getting a no-deal Brexit? Now, Matt Hancock has said to the COVID inquiry this morning that he wasn't enthusiastic about signing off on that decision.
Now, as the Minister who's now responsible for pandemic preparedness, what I really want to hear from the inquiry is lessons learned and how we can prepare for any future pandemics. And I think it's important to look at all the factors. But if you look at the increase in NHS funding, we're putting in over £190 billion every year. That's a 37% increase since 2019. So our focus is investing in the NHS, investing in our staff and giving them a pay rise, and getting services turned around after the COVID pandemic with the backlogs that created for routine care, so that patients can get access to the care that they want. So absolutely, as the Minister responsible for any future pandemics, I want to learn the lessons from the last pandemic and make sure that we are better prepared for any future events.
As a Tory minister, are you comfortable with a Conservative Tory mayoral candidate being accused of sexual harassment in number 10? Are you comfortable with that? And CCHQ have said they're not investigating. Why not?
Well, absolutely. If there's any allegations or complaints, they need to be properly investigated by the police. I don't know if the police are currently involved, but absolutely we take those allegations very seriously. I can't comment on an individual case because there could be criminal matters, but absolutely, if women have experienced that, they absolutely must call it out at every opportunity.
Will you pull out of the race?
I'm not going to comment on an individual case. I don't know the details of the complaint, but it's right and proper that if someone has experienced that, they do raise the concerns and that proper action is taken.
Health